Hello everyone, welcome to Dr. Rahul's Medicine. Now in this video, we will talk about one neurological condition which is called as Alzheimer disease. Okay. Now in this video, I have added one more thing is that at the end of the video, there will be a summary table. Okay. In the summary table, I have mentioned all the important point which I will be talking about in this video. Okay. So I will recommend you to watch this video firstly and then go through that table, or you can take a screenshot of that table and you can revise that table just before the exam. Okay, now let's come back to our topic. It is Alzheimer disease. Now this Alzheimer disease, it is the example of cortical dementia. It is the example of the cortical dementia. Okay, now let's see what is the main pathology in the Alzheimer disease. Now in the brain we have one area, and this area is fully loaded with acetylcholine. Okay, and this area is called as the nucleus of Maynard basalis. Nucleus of Maynard basalis. Okay, now this nucleus of Maynard basalis is fully loaded with the acetylcholine, but in case of Alzheimer disease, what will happen? The acetylcholine level will be decreased. The acetylcholine level will be decreased in this condition. Okay, so this is the main pathology in the Alzheimer disease. Now let's talk about what are the risk factors for the Alzheimer disease. The first risk factor is the age, or we can say the age is the most important risk factor. It is the most important risk factor. The other risk factor include genetics. Okay, now in the genetics, what we have to remember is that it is related with the three component. The first one is the ApoE4 overexpression. ApoE4 overexpression. Okay, the second thing is we have the presenilin 1 gene. Presenilin 1 gene. And third we have the presenilin 2 gene. Presenilin 2 gene. Okay, now about this what we should remember, the ApoE4 overexpression. Okay, in this the ApoE is located on the chromosome number 19. Okay, and the presenilin gene is located on the chromosome number 14, and the presenilin 2 is located on chromosome number 1. Okay, now about ApoE4 overexpression, there is one important question is that it is the most important risk factor. It is the most important risk factor for sporadic Alzheimer disease. Sporadic Alzheimer disease. Okay, now let's move to the other risk factor. The other risk factor include female gender, aluminum and mercury toxicity. Aluminum and mercury toxicity. Okay, history of head trauma, and there is one more term which is called as the type 3 diabetes mellitus. Type 3 diabetes mellitus. Now this type 3 diabetes mellitus is equivalent to Alzheimer disease. Now how? Because it will cause the insulin resistance in the brain. This Alzheimer disease will cause the insulin resistance in the brain. Okay, and the other risk factor will be a Down syndrome. And a patient of Down syndrome, if have the Alzheimer disease, so it will in the future it will lead to the presenile dementia. Now let's talk about what are the findings in case of the Alzheimer disease. Now the finding can be broadly divided into two. This finding can be the intraneuronal finding, and it can be the extraneuronal finding. Okay, now in the intraneuronal findings we have the neurofibrillary tangle. And this NF tangle or the neurofibrillary tangles are made up of the tau protein. Whereas in the extra neuronal finding, there will be deposition of the A beta amyloid. There is deposition of the A beta amyloid. Okay. Now there is one more point. This neurofibrillary tangle, or we can write like that, NF tangle, okay, is directly proportional to the severity of disease. It is directly proportional to the severity of the disease. Okay. Now here you can, in between these two arrows, you can see it is the neurofibrillary tangle. In between these two arrows, this structure, it is called as the neurofibrillary tangle. Okay, which is made up of the tau protein. Okay. Now let's move to the clinical feature. Now the clinical feature will depends upon the which lobe is involved. Which lobe is involved. So in the Alzheimer, there are mainly two lobes involved. Two lobes are involved. These are the temporal lobe, and other lobe is the parietal lobe. Parietal lobe. Now if the temporal lobe is involved, then the patient will have the amnesia. The patient will have the amnesia. And the amnesia is characterized by the short-term memory loss. Short-term memory loss, which is then followed by long-term memory loss. Which is then followed by the long-term memory loss. Okay. Now in the parietal lobe, we can have the two features. The first one is the aphasia. The first one is the aphasia, and the second one is the apraxia. The second one is the apraxia. Now let's talk what these terms means. Amnesia means the loss of memory. Aphasia means the patient is inability to speak or communicate, and apraxia means the patient will have the lack of skillful movements. Okay. Now always remember, in the Alzheimer disease, acalculia is not a feature of Alzheimer disease. Acalculia is not a feature of the Alzheimer disease. Okay. Now let's move to the diagnosis part. Now in the diagnosis, we have the two methods. Either we can perform the screening method, or we can perform the definitive method, which is the investigation of choice. The screening method consisting of the mini mental status examination, MMSE, whereas the investigation of choice consisting of the MRI. And what we will find in the MRI, there will be a cortical atrophy. In the MRI, there will be a cortical atrophy. Okay. Let's see here. This is the MRI of the brain, which shows there is a cortical atrophy. You can appreciate there will be a cortical atrophy. This is a classical MRI of the Alzheimer disease, where you can see the cortical atrophy. Okay. Now let's move to treatment part. Now for treatment, we have a drug of choice by the name of donepezil. Donepezil is the drug of choice for the Alzheimer disease. Okay. So this is all about the Alzheimer disease that you should know. Now let's come to the summary box. Okay. Now in the summary box, as we already discussed, it is the example of the cortical dementia. In the Alzheimer, the acetylcholine level will be decreased. There will be overexpression of the ApoE4. In the Alzheimer, we can find the neurofibrillary tangles, which are made up of the tau protein. Their deposition of the A beta amyloid. The acalculia is not a feature of Alzheimer. We may have the amnesia, we may have aphasia, we may have apraxia, but the acalculia is not a feature of Alzheimer disease. The investigation of choice for the Alzheimer will be MRI, and a drug of choice is the donepezil. So this is a summary box. I will recommend you to revise this summary box just before the exam. Okay. Thank you so much.